KPBS On Demand is supported by Splatero, helping homeowners pay off debt by offering streamlined access to your home's equity with no additional monthly payments or new debt. Splatero provides a lump sum payment in exchange for a share of your home's future value. Pre-qualification is available at splatero.com.
Good morning, I'm Annika Colbert. It's Monday, February 15th. The latest plans for reopening schools, we'll have that next, but first, let's do the headlines. San Diego public health officials reported more than 500 new COVID-19 infections on Sunday and 28 additional deaths. New shipments of the Moderna vaccine have been delayed, and that's forced some vaccination sites across the state and in San Diego to temporarily shut down, slow vaccinations, or reschedule appointments. A new shipment is expected on Tuesday. Meanwhile, coronavirus infection rates and hospitalizations continue to fall across California, though the death toll remains persistently high. The state reported more than 400 deaths on Sunday. The overall total in California for more than 46,000 deaths is now the highest in the nation, surpassing the total death toll for New York State. Despite the grim numbers, health officials are confident that the worst of the infection surge is now over. California state parks announced plans for turning an oil refinery property along the Central Coast into a huge off-road recreational area. The proposal is for the Phillips 66 Santa Maria refinery near Arroyo Grande. The refinery is still operating now, but it's planned to close by 2023. From KPBS, you're listening to San Diego News Now. Stay with me for more of the local news you need.
KPBS On Demand is supported by UC San Diego's Art Power, presenting cellist Joshua Roman, performing from his album Immunity, alongside music by J.S. Bach and more. Sunday, June 22nd at UC San Diego's Epstein Family Amphitheater. Reserve your tickets at artpower.ucsd.edu.
There's some updates from federal, state, and local authorities on how and when to reopen schools. KPBS education reporter Joe Hong has more.
San Diego Unified School District officials are now saying that a return to full in-person learning is all but certain in the fall, and they're increasingly optimistic that more students will be able to come to campuses in the coming months, even if it's just part-time. Richard Barrera is the president of the school board at the district.
We're very confident, Joe, that we can open in the fall. We're very confident that we will be able to have an expanded summer program. And if trends continue the way that we're seeing right now, we believe that we're going to have more of our students on campus in the spring.
He applauded yesterday's announcement by County Board Supervisor Nathan Fletcher that the county will begin offering vaccinations to teachers within the next 3 weeks. Barrera said vaccinating teachers is crucial.
We need to get the virus under control in our community, and the case rates need to be in decline. Is kind of the second key part of that pathway to reopening. And the third is we need to vaccinate our educators.
Meanwhile, Governor Newsom's office today launched its interactive map showing which districts in the state are operating in-person, hybrid, or distance learning only. Also on Friday, the Centers for Disease Control and Prevention released its much-anticipated guidance for reopening schools. The guidance introduces its own colored tier system. Counties in the blue tier for low transmission or the yellow tier for moderate transmission are encouraged to reopen for in-person learning, even if teachers aren't vaccinated. San Diego County as a whole is currently in the yellow tier, but parts of the county, especially in the South Bay, remain in the orange tier for their higher transmission rates. Barrera said San Diego Unified officials will consult with UCSD experts over the weekend about how the district will respond to the new CDC guidelines.
And that was KPBS education reporter Joe Hong. A new pilot program is taking a neighbor-to-neighbor approach to reach people most impacted by COVID-19. KPBS reporter Matt Hoffman has more from City Heights.
It's very grassroots. Moms, neighbor to neighbor.
Miriam Rodriguez with the San Diego Latino Health Coalition has been working as a promotora or community health worker in City Heights for 15 years now.
Promotora work is so important. It's part of our culture. You are welcome. You're here. How can I help you?
Latinos make up the majority of coronavirus cases in San Diego County, but they are not getting majority of vaccinations. Officials hope that by sending teams out to areas like City Heights and the South Bay, that will change.
We go to different supermarkets all over the county, all the promotoras. Not only are we listening to each other, but we're encouraging them. Hey, I already had the vaccine last week. I'm feeling great. Go ahead. Do you need help signing up? Can someone in your family help you sign up?
Rodriguez says she is hearing some fears about the vaccination and potential side effects, but she says many here want to know when a large-scale vaccination site will be coming to City Heights.
When is it going to be next for our people? Because they're ready. They want to do it.
Rodriguez says some people in this area do not have easy access to transportation, so officials have to bring vaccines to the community. She also says not everyone is on social media and some seniors are not online, so taking the vaccination message directly to them is key.
We share our own experience and then we let them know as well, hey, this is a flyer so you can know more in your language how the face is, but at the same time, call me, send me a message. I'm here for you.
The San Diego Latino Health Coalition is one of many groups working to make sure everyone who is eligible for a vaccination appointment is able to get one.
We just want to make sure that they are actually getting the information because they might not be getting it, and we're trying to close that gap.
Sanitizers, masks, and wipes.
The Chicano Federation is also sending out teams across the county to deliver vaccination information. They are also continuing to hand out supply kits with masks and sanitizers via appointment only. Seniors 65 and over plus healthcare workers can book vaccination appointments through the county's website.
And that story from KPBS's Matt Hoffman. California farmers are running out of wildfire insurance options. iNewsSource investigative reporter Camille Von Cannell has this story about how one San Diego County rancher's case sparked a statewide effort to get farmers help.
On Nathan Rakove's 30-acre chicken ranch in rural Alpine, cattle and sheep graze on the brush to lower fire risk. But that hasn't helped him find insurance.
We'd like to think that the system's going to work, and they're going to come up with ways to give us credit for doing mitigation. At this point, for the most part, insurance companies have just redlined certain zip codes.
He uses California's last resort insurance, the FAIR Plan. But when he tried to add a tractor to the policy last year, he got rejected. He was told farms aren't eligible. He turned to Hannah Bay, head of the San Diego County Farm Bureau.
I said, this is unacceptable. We cannot get a letter issued from the fail-safe fallback program saying farmers are not allowed to have coverage.
She got the California Farm Bureau involved. So far, about 24 farmers in the state say they've also been turned down for the FAIR Plan. The plan's president says state law forbids it from insuring farms. State Senators Ben Hueso and Tony Atkins from San Diego are now working on a possible fix.
That was iNewsSource investigative reporter Camille Von Cannell. iNewsSource is an independently funded nonprofit partner of KPBS. State lawmakers are trying to reconcile the sometimes conflicting values at work at public hospitals and Catholic hospitals who collaborate on patient care. KQED's April Demboski reports.
For years, UC doctors and medical students have provided care at nearby Catholic hospitals as part of their training and as a way of expanding specialty care to more Californians. But UC providers are bound by Catholic Church directives that prohibit them from providing abortions, sterilizations, and gender affirmation surgery inside Catholic hospitals. Senator Scott Wiener says this makes the public university system complicit in discriminating against women and transgender patients.
The fact that a UC medical professional would not be able to provide that care, I just think is honestly completely outrageous.
Wiener's new bill would require UCs to either renegotiate their contracts with Catholic hospitals to allow UC staff to provide all care or to end those affiliations altogether. Lori Dangberg from the Alliance for Catholic Healthcare says now is the worst time to do that.
COVID-19 is placing unprecedented demands on our state's healthcare providers. Any effort to weaken the safety net would only harm the state's most vulnerable patients.
Dangberg says pressuring Catholic hospitals to allow abortions within their walls is intolerant and could jeopardize healthcare for tens of thousands of Californians.
And that story from KQED's April Demboski. California is looking at a major restoration project for the Salton Sea. KPBS environment reporter Eric Anderson has more.
The state is investing more than $200 million in a project that'll create flooded ponds and other habitat on the exposed lake bed at the southern edge of the lake.
We'll complete the work over the next 2.5 years. I believe completing the project in 2023.
State Resources Secretary Wade Crowfoot says the Salton Sea has been shrinking rapidly since 2018. California committed to a multi-billion-dollar restoration effort as part of a deal that allows water to be sold to cities like San Diego. The project couldn't be started soon enough for Imperial Valley clean air advocate Luis Olmedo.
It is a best available control measure to do water habitat types of project, and that's what the federal government requires.
State officials eventually hope to cover close to 40,000 acres of exposed lake bed.
And that story from KPBS environment reporter Eric Anderson. Coming up, is it possible to reopen San Diego's theme parks anytime soon? We'll have that conversation next, just after the break.
KPBS On Demand is supported by Markel Design and Remodeling, helping homeowners with their home remodeling needs. From ADUs to kitchen remodels, room additions, and custom homes, Markel Design and Remodeling can help homeowners design and build their dream homes. More at trustyourhometous.com.
The latest COVID-19 vaccination superstation opened at the Del Mar Fairgrounds over the weekend. Though whether the Del Mar Fair itself will return in the summer remains to be seen. Other popular attractions like the San Diego Zoo and SeaWorld are currently open only on a highly restricted basis, though all theme parks across the county want restrictions to be eased and to allow for more visitors to come back. But can they? Lori Weisberg covers tourism and marketing for the San Diego Union Tribune. She spoke with KPBS Roundtable host Mark Sauer about the latest.
Well, your story this week focused on a bipartisan bill introduced in Sacramento regarding restrictions on theme parks in California. Start by telling us who introduced the bill and what do these lawmakers want Governor Gavin Newsom to do?
Okay, so these are two Southern California lawmakers. One is Assemblywoman Sharon Quirk Silva from Fullerton, and her district includes Disneyland and Knott's Berry Farm. Collaborating with her on the legislation is Assemblywoman Martinez Valladares from Santa Clarita, and her district includes Magic Mountain. So basically, they're trying to get the governor's office to move up or accelerate when theme parks can open.
Now, if somehow they got the governor to come in their direction and places like Legoland and Disneyland were allowed to open again under restricted conditions, what would those restrictions look like? What might visitors expect to encounter?
Well, it would still have to be about at 25% capacity. The state wants a reservation system so that you have to make a reservation to come to the park at a certain date and time ahead of time. Obviously, very strict masking at all times, those kinds of, sanitation. I mean, the theme parks say they already have those kinds of measures in place. They're letting people come for shopping, like in Disney. It's downtown Disney is open, so they already have the drill down for the sanitation, the social distancing, the mask wearing. But capacity would be significantly less, just as it's supposed to be right now for the zoo and SeaWorld, which are allowed to be open under rules for zoos and aquariums.
And anecdotally, you're getting any feedback on how it's going at these parks when they opened again recently? Are they doing okay with these restrictions?
I think so. I mean, I think they're doing okay. I did talk to, incidentally, I talked to a coworker who was at Safari Park last weekend, who said it wasn't so much about the measures they were taking. She said it seemed almost as full as when, she had gone pre-pandemic. But
Really?
So far, I haven't heard any complaints about that they're not following the restrictions and they're not keeping things under control. I mean, they are requiring online reservations, which, you've never had to do before.
Right. Now, other places have gone ahead and opened theme parks elsewhere. While California's kept most of them closed, as we're talking about, or severely restricted. What have California officials learned in trips to, say, Florida?
So Florida has had their parks open for some time, initially at reduced capacities. And I think in general, they were pleased with the what they saw. We also know from some reporting that none of these parks apparently have had any major outbreaks. I at one point talked to a reporter at the Orlando Sentinel who said there may be some minor outbreaks, but for the most part, there has not been any reporting on any major outbreaks at any of these parks. So there's a sense that they're doing well, that the precautions they're taking are working. But apparently the governor's office was still very worried because people are coming from all over the country to these parks, and they feel like they don't have enough control over that crowd. So they're being very cautious on the theme parks.
Now, it certainly makes you wonder about the financial situation at these parks. SeaWorld was just recovering from that blackfish scandal before the pandemic hit a year ago. Do we know how they fared during the pandemic? I mean, we've got federal relief funds coming in. Are they keeping them going? What do we know about the zoo and Legoland and other theme parks?
Yeah, like for instance, SeaWorld has had to take out substantial loans that they plan to on their own that they plan to pay back. Even with their parks closed, even with their parks open in Florida and elsewhere, but closed in California, they're still taking a significant hit on their revenue, but they do expect to recover. Their latest earnings are coming out later this month, but I thought it was interesting. Disney's earnings just came out for their first quarter ending January 2nd. And they have a division that they call their parks, experiences, and products, which also includes cruise ships. So you get a flavor of the park. So that the revenue from that sector alone fell 53%. They say they lost about $2.6 billion in lost operating income during this most recent quarter, even with some of their parks open elsewhere. Of course, Disney's got so many more assets, so that helps make up for the losses in their parks and cruise business.
Yeah, they're different one to the next. And who knows if President Biden gets his massive $1.9 trillion relief bill through, maybe it would have help for these kinds of businesses. Finally, I want to ask you about the vaccination programs. We stumbled in California. Things seem to be getting better day by day. I mentioned the big site's going to open at the Del Mar Fairgrounds. Any idea at this point what percentage of the population would need to be vaccinated, presumably with a corresponding big drop in the number of cases before these parks would be allowed to return to something close to normal operations?
Well, I know that is the $64,000 question. Who can predict when there'll be enough immunity through people having had the disease or through vaccines that you bring that case rate number that we were talking about earlier down to a level that would let them go into these less restrictive tiers. So I think it still could be months, but maybe the vaccines could be so accelerated that maybe those case rates could fall that dramatically. It's just so because we're so early in that vaccine process, it's hard to know how quickly the case rates follow, though, as you pointed out, they already are falling right now.
That was Lori Weisberg of the San Diego Union Tribune speaking with KPBS Roundtable host Mark Sauer. And for our arts segment today, Diversionary Theater is the third oldest LGBTQ theater in the United States, and it's decided to take advantage of having to be closed for the pandemic by beginning long overdue building improvements. KPBS arts reporter Beth Accomando spoke with its executive artistic director, Matt Morrow, about what that remodel means for the organization.
Matt, we are sitting in the middle of what used to be your lobby space here at Diversionary. What is going on right now?
Well, what's not going on right now? We are in the middle of renovations. They started demoing the entire building about 2 weeks ago. and they're making really good headway. This space, our lounge, is going to be transformed into our third performance venue, which we're really excited about. It's going to be a cabaret space, and it's going to have a full bar experience. And so we've been working really hard with our designers and our architects on what it means to honor the gay bar of yesterday. And so our cabaret is going to stand in honor of the gay bar as a historical place where our community gathered and organized and communed with one another and really launched the LGBTQ movement that we know of today.
Now, I know this pandemic has been challenging for arts organizations. However, doing this renovation while we're in the midst of the pandemic seems like it's making the best use of this kind of time.
Yeah, it's really strange. We were working on this campaign for about a year before COVID-19 hit. And when COVID-19 hit, we were completely surprised. We didn't know if we can continue with the campaign or if we should continue with the campaign. But we had a gala event that happened about 3 weeks after COVID-19 hit. And that gala, which had to migrate online and be virtual, really showed us how much our community loves Diversionary and put a lot of wind in our sails. And we were like, you know what? We should continue with the campaign. And also, while we're at it, all theaters are going to need to address COVID-19 and safety and security measures. Let's take those things that we're learning about COVID-19 and how to make our public spaces more safe and integrate them into the design while we have this opportunity.
So what were some of the post-pandemic things that you decided to add to the theater that you had not thought of doing before?
Well, the biggest thing that we're learning about is that the virus really travels through the air. And it's really about air filtration and optimizing our HVAC system. So we're integrating a bipolar ionization filtration system to all of our HVAC systems for our public spaces. We're also incorporating antimicrobial materials into the design. We're also incorporating hand sanitizing stations throughout the facility. So whenever you feel like you need to sanitize your hands, you're just an arm's reach from one.
And talk a little bit about what the renovations will mean for the actual theater space itself.
We're getting all new theater seating, which I'm sure our patrons are going to be super happy to hear about, because the theater seats before were way too small and very old and uncomfortable, and frankly loud. They had springs that would constantly go boing right in the middle of the most tender moment of a performance. We're also going to be able to expand our main stage. The actual stage itself is going to gain about 3 feet, and so that's going to increase the type of work that we're able to produce on that stage.
And can I ask how much the remodel costs?
The entire remodel is $2.5 million, and we are just over 80% of our way to achieving that $2.5 million goal.
And you said you're at 80% of the fundraising goal, so what's the plan for paying for the rest of it?
We've been fundraising from our closest friends up until this point, and now we're turning to the public and starting the public phase of the campaign. And so we're going to be engaging the public at large in the campaign moving forward. Yeah, that's pretty much it. We're now just asking for money from everyone instead of just a select few of people.
All right, well, I want to thank you for talking about Diversionary, and I look forward to its reopening.
Thanks so much, Beth.
That was Executive Artistic Director Matt Morrow speaking with KPBS arts reporter Beth Accomando. If you can check out tonight's evening edition, you can see what the Diversionary Theater's remodel will look like, or check out Beth's web story at kpbs.org. And that's it for the podcast today. Be sure to catch KPBS Midday Edition at noon on KPBS Radio, or check out the Midday Edition podcast. You can also watch KPBS Evening Edition at 5 o'clock on KPBS Television. And as always, you can find more San Diego news online at kpbs.org. I'm Annika Colbert. Thanks for listening, and have a great day.
KPBS On Demand is supported by Paint Care, offering households and businesses in California more than 800 leftover paint drop-off sites for recycling. Quantities of 100-plus gallons of paint may qualify for a large volume pickup. Learn more at paintcare.org.